Thank you for joining me for a brief discussion here at WHX Tech. You participated in the panel about digital transformation in different healthcare systems. For beginning, which governments did you work with so far? I know that you've got a lot of experience internationally.
Tasha, thank you for having me. It is always wonderful to talk to you and explore thoughts and ideas. Well, governments, okay. In my data and digital health space, I think I was very privileged to play both executive role as well as advisory to governments. So I was medical director for Scotland, means responsible for the national function. Data and digital was included in Public Health Scotland function. Then I was national director for innovation and quality for England. I was medical director for Care Quality Commission, which is the national regulator. And of course, in the theme of data, they use all the data to regulate the whole health system. So 30,000 organizations, they regulate health and social care. In my advisory capacity, I don't know how many, but Turkey, I was advisor to the Minister of Health of Turkey. I've been advisor to the Minister of Health of Qatar, and I've been advising to Europe and of course the Middle East. And I've been helping a few countries in the Far East. But the motivation is, if my knowledge can add value, can nudge people, can act as a catalyst to help things get better, then being a doctor, being a clinician, my prime role, I chose this profession, was to save lives, to improve the quality of life. And this is my goal in my capacity as an advisor, as an executive, wherever I work.
What are your observations in terms of how our governments and healthcare systems trying to embrace AI? Not all healthcare systems are fully digitized, especially on the national level. So how do you see that AI comes into play and is used by the ministries?
Well, Tasha, first we need to define what health systems are. Basically, we divide the health system into 4 groups. First one is we call Beveridge system, which is public run, public funded, which is UK and Spain, example. Other we called the Bismarck system, which is privately run, privately funded, which is Germany and Japan. Third one we call national insurance system, which is publicly funded, privately run. Examples are Canada and South Korea. And the last and fourth one is emerging economies, out of pocket. So it depends which system we pick up. So let's, for sake of argument, we pick up a system like the UK or Spain. Over there, because it is a centralized system, so things are happening by the national policy and get implemented because publicly funded and it is publicly run. So a good example is that if you want to have an app going to be used or EMR going to be used in England or any app, then if it get approved, all the marks, then it will get implemented. Let's move on the same example when we go into a system like Bismarck, the Germany and the Japan. Then you need to work bottom up because every organization is an entity itself because they are running the whole system by themselves. So there are pros and cons. But if you go to the national insurance system, Canada has done wonderful things because they developed the first AI strategy, by the way, right? So if you think about Canada, that they have got centralized way of publicly funded and privately run at the provincial level. So I see that at the end of the day, if you have the data at the national level and you can regulate it, for AI we need, for example, we talk about Europe. Europe is getting European health data space. 400 million people, they are going to share their data. If we are able to take the public trust, then we use that data to develop the models. It is going to help and save lives, improve the quality of life. But then the question comes, if you are in a health system where the public hasn't got the trust, then they are not happy to share the data. So how you're going to build the AI? So AI will be just an example, but it won't be applied effectively. So this is the way I see that how and where you are and how best you can advise those health systems and those AI organizations, they can be effective in there.
Mm-hmm. So Europe, as you mentioned, has EHDS we've got the EU AI Act. How do you see regulation in other regions in that respect? How much are you looking into Europe as an example of how things could be regulated? And basically, is the lack of regulation hindering progress in AI adoption?
Okay, let's start where we are now.
Yeah.
Let's pick up UAE, right? A very good example where they went with regulatory sandboxes. So it means you need to test out the regulation, because regulation could stifle innovation. If you regulate too much, you can stifle innovation. If you regulate too less, then safety get compromised. So this is the whole balance people need to do. So we know that when we need to develop a drug or medicine, we do pilot. And we have an environment to do that pilot under certain regulatory conditions. I think what UAE has done, it particularly the way they developed the regulatory sandbox. It means that if you want to test a regulation, do it like exactly you do the pilot. So this is a very good innovation they have done, and other countries need to learn. Now, if you think about that, how the regulation is so-called mushrooming, I personally believe we do not need to reinvent the wheel, because the core regulation, because AI needs to be safe, it needs to be ethical, it needs to be equitably available, all those things. These are the basic things. EU had done excellent things, so they have got the first AI regulation, and they have passed the act, and I think other countries need to learn. Then one of the place where the biggest advancements are happening on AI is America. So OpenAI is an excellent example. So how things are happening over there, then I still say that I think the America is doing wonderful things, because if I look practically what you need for AI to be useful for human health, you need 4 layers, value layer we call it. First, you need to have semiconductors which can process the data. You need to have the data, you need to have the software, and you need to have internet. Of course, not every country can make the semiconductor, right? So NVIDIA is a good example. They are doing wonderful things, and they are one of the biggest companies. What we need to do is that, can we develop the data centers where that data could be processed? Wonderful example is happening in Abu Dhabi. So they are going to, OpenAI is going to, I read it, OpenAI is going to build the 1 gigawatt data center in Abu Dhabi. So it means what we need to do, that the population of Middle East, their data could be used to develop the AI tools for them, not for the data which is coming from the Europe and the models coming from the Europe. And this is the way I see that you need to look at the regulation. Can it thrive the AI, but at the same time it shouldn't compromise the safety?
Yeah. Speaking of the UAE, where we currently are, what else would you say is the strong point of the healthcare system and healthcare development here, and the innovation and digital health?
Look, for healthcare innovation, we need to have an ecosystem. So let me give you a few ingredients of that ecosystem. First, you need to have a national digital health strategy. You need to have a national data repository. You need to have the workforce. You need to have a central place for ideas and solutions. And I can go on. So let's test it out on the few systems. Few countries within Middle East. In Qatar, there is a national health strategy, and there is a strong element as a pillar of digital health. You come to Dubai or UAE, it is the same. And by the way, WHO has got a digital maturity index or monitor. And within Middle East, the 2 countries which are on the top are Saudi Arabia and UAE. So that's a good example that how the other question, the other ingredient or a topic I mentioned is about the workforce, right? And my question to my clinical fellows and clinical colleagues wearing my Royal College hat, how much of you know or have digital and data literacy? It means ability to access, understand, and use digital and data tools. If you haven't been taught in the medical schools or nursing schools, then it means that government can put a lot of emphasis, bring the best things for you, but you have a fear of unknown. And I think this is my question back to the academic world, that they need to develop that data literacy. Then, last but not least, public-private partnership. Without that, no government can deliver it at its own, and no private sector can deliver at their own. So, if you look at Oman, they developed a wonderful strategy over there. So, Saudis are doing excellent thing in all of their clusters, but they have a central focus. One example I can give you, people come for Hajj. So millions of people come all over the world for Hajj in Mecca once a year. Question is it possible that those people bring their health records with them, because when they get ill, so that they can get the best treatment? So they developed a tool working with other countries, Saudi Arabia, Malaysia is on board, UAE is on board, and few other countries are coming, they're in the pipeline. When their people come for Hajj, they have developed the app, all the data comes, the basic core data comes with that. So the question for the future is that we need to help the data follow patient, which is happening in Europe. Right, when you move countries, you go and get your prescription in any country now, right? Yeah. So you get prescription written by a German doctor, and you're traveling to Spain, and you can get it over there. And this is my question, my motivation to GCC, the countries, 6 GCC countries. Why your 60 million people cannot get benefit from the same thing which is happening in Europe? I'm very happy to advise and help.
So maybe that's the next step in the development.
There's the next step in the development, that we need to be thinking how we do the international collaboration, so that the innovation happen at the international level and should be applied. So people see the value. What is innovation? When it creates a value for patients, for public, for professional. If I am a patient and diabetes is one of the most common problems. Right? People move around, go for holidays all over GCC. So when people move around, they need to be assured to themselves that, look, wherever I go, my health record will follow me, and it will be read by the other doctor wherever he or she is, and then I will be given the best care. Right? So this is the way I see that we can become one humanity. We can work together to make things happen by learning from each other's experience, but we should be very focused.
Yeah, absolutely. What do you see as the key drivers of success here in the UAE? You mentioned earlier that according to WHO, they're very high in terms of the development. There's a lot of strategies also for healthcare digitalization. Ambition is definitely here.
You're right. Ambition is everything here. You pick up anything, the tallest building, the Minister of Happiness, I never heard of that. There is any other country they think like, they talk about well-being. I mean, this is a wonderful idea, same in Qatar as well, same in UAE, but the key thing is, first thing is the leadership. Because the clarity of vision need to come from the top leaders, and I believe in distributed leadership. Of course, His Highness Amir or these Royal Highnesses, they cannot do things. They need to distribute their leadership, give people authority, make them accountable, but the people can make the decision at the lowest level. So this is the first thing which is happening in UAE. You just said it. Second thing, I feel why everything is thriving, because they are very keen to make a mark, because it's a human nature. First, we want to get valued, acknowledged, and second, we need to show our achievements. And they are very keen, same in Saudi Arabia, they are very keen that we are 40 million or 35 million population, and we are very keen to show that our population health is one of the best, and digital health is the key intervention, and this is the reason they are putting a lot of emphasis on digital health. So you need to be very clear about your motivation why you are doing it. And the third thing which I say, that you need to have that environment. We are sitting in WHX Tech. Why is this happening in Dubai? Why it is not happening in England? I mean, I must say, I could have asking to do it in London, Manchester. We could think about doing it in Barcelona. Why it is happening over here? Because they created the environment where people can come with their best ideas, and then they will take their best ideas and change them into reality. And these are the things I found. This is the reason I'm sure the future is very bright.
Mahmood, thank you so much for a short discussion here.
Thank you very much, Tasha.